How to avoid incontinence after childbirth. After delivering a baby, it is hard for a new mother to focus on anything besides her new bundle of joy. They need someone to feed them, change their nappies, hold them, rock them to sleep, which is downright adorable. With little to no time on your hand, you may not pay attention to your changing body, along with postpartum symptoms like constipation, sore breasts, and perinatal pain. You may experience that it's harder to control your bladder. If you are experiencing bladder and bowel incontinence, try not to worry. There are treatment options available to treat bladder weakness after birth. What is incontinence after birth? The miracle of giving birth can do odd things to your body. As your baby makes its way through the vaginal canal during childbirth, your organs adjust, your pelvic floor and bladder muscles stretch and remain stretched for some time. This means the muscles that control your bladder are weakened, which can lead to your involuntary leaking urine. Some women also experience bowel incontinence, which is the unintentional loss of fecal matter. You may experience weakened bladder control symptoms while sneezing, coughing, or performing strenuous activities. Bladder incontinence symptoms are very common after childbirth. How to avoid bladder weakness after birth? Increase water intake. Drink at least 8 to 10 glasses of fluids a day unless your healthcare provider tells you otherwise. Avoid bladder irritants, carbonated beverages, alcohol, spicy food, and refined sugar, as these can irritate the bladder and make it contract more easily. Extra weight puts constant pressure on the bladder. That is why maintaining a healthy weight is essential. Have a high fiber intake. Include fruits, vegetables, cereals, and bread into your diet. Avoid lifting. Stop smoking. Women who are regular smokers often have a chronic cough, which puts pressure on the weakened bladder. Do regular Kegel exercises. They are one of the best ways to strengthen your pelvic floor. To do this, squeeze your pelvic muscles and hold them for about 10 seconds. Train your bladder. Use the bathroom every 30 minutes and then extend the amount of time between bathroom trips each day. Go to the toilet when you feel like having a bowel movement. Avoid constipation no matter how long it takes. Constipation can put a strain on the pelvic floor muscles. What to do if you suffer from incontinence after birth? Long hours of labor and vaginal birth affect the pelvic floor muscles and nerves, which may later lead to bladder weakness after birth. Cesarean deliveries are associated with a lower risk of incontinence than vaginal deliveries, but they may present other risks such as nerve damage during childbirth. Talk to your health care provider if you have bladder control symptoms. Many women get to experience incontinence issues after they deliver a baby. You shouldn't have to deal with bladder incontinence and bowel incontinence alone. Being embarrassed and not seeking help can leave you feeling lonely and affect you mentally. So take a deep breath and speak to your doctor or midwife and partner about what is happening to you. With therapy and management, women are able to regain control of their bladder in little to no time. Thanks for watching. Don't miss another informative video.